Good afternoon and welcome. I'm Rupa Lloyd. I'm chair of the Health Law section of Florida Bar, and I'm also an attorney with Gray Robinson here in Gainesville. It's a pleasure to host today's Fireside Chat, which brings together two worlds that often operate in parallel, but rarely pause to reflect together: health law and public innovation. As health lawyers, many of us spend our days navigating complex regulatory frameworks, advising hospitals, health systems, and companies on compliance, reimbursement, and risk. We see firsthand how government can feel slow, procedural, and at times resistant to change. And yet we also know, especially those working closely with policymakers and agencies, that within those same structures are opportunities for meaningful impact. Today's conversation explores that tension. It is my honor to be joined by Dr. Christopher Cogle, who's a professor of medicine at University of Florida, chief medical officer for Florida Medicaid, a physician scientist, health policy leader, and author of a new book, Public Startup: How America's Least Likely Government Program Became Its Boldest Experiment. In his work, Dr. Cogle offers a different lens on government, particularly programs like Medicaid, not as static bureaucracies, but as dynamic platforms for innovation in law, healthcare delivery, and public policy. Chris, thank you for joining us. I have to say, first of all, I absolutely loved your book. It was very enlightening for me to see Medicaid in a completely different light. So one of the concepts you talk about is this moral algebra. What do you mean by that, and why is it important today?
Yeah. Well, first, thank you, Rupa, for inviting me to this fireside chat. What I mean by moral algebra is that there's this invisible math that's behind every policy decision. It's what we choose to value, what we're willing to risk, and ultimately who bears the consequences of these health policy decisions that we make when we write them. And it matters now because those trade-offs that I just mentioned, they're becoming more visible and more consequential, especially in healthcare, where there's the decisions that are being made they don't affect just systems, but they affect individual patients. And with media and social media, those consequences are very visible.
So, you mentioned healthcare. So specific to healthcare, to help people kind of conceptualize, can you give some examples of what moral algebra would be?
Sure. Yes. So every policy decision, whether we name it or not, is solving for a set of competing values. In healthcare, those trade-offs, they show up again and again. So as an example, we're constantly balancing access and cost. So if we expand access, cost is going to rise. And if we constrain the costs, then someone's going to lose access to those services. Another one is that we're balancing innovation and safety. So if we move too quickly, we are going to risk harm. If we delay that progress, then we're going to delay helping more people. So that's a trade-off. And then another one, and I think this is the one that clinicians really struggle with, and we need the help of attorneys, is balancing between individual benefit and the population impact. So what's best for one patient, which is the typical clinician view of the world, is not always what scales to millions of people. And there's examples like colon cancer screening. Normally we'd recommend a colonoscopy for an individual, but if you want to scale a policy, colonoscopies on everyone may not be the best decision because of its risk of harm, and also there just aren't enough GI docs to be able to do that. So it's always a challenge, and that trade-off is the algebra that's underneath.
So tell me, as lawyers, what can we do? How do we show up to kind of help with this question of moral algebra?
Yeah, great question. I think that lawyers always get a bad rap. You guys are looked at as being interpreters of the system. But I don't think that's right. You are actually architects. That's been my experience in health policy is you are actually implementers and architects of the system. So you're translating broad policy in the various contracts, in regulations, in the compliance frameworks that you build. But in doing so, you're actually shaping the behavior of doctors like me. You're shaping the behavior of hospitals and their executives.
Yeah.
You're absolutely architects. And those decisions that you make, whether explicitly, and I would argue often implicitly, really shape how the health system is functioning. You're not just managing risk. For example, you're deciding who's going to bear the risk. So if you have a contract between, let's say, a health insurance plan and a doctor's office, you're deciding in that contract where that center of gravity of risk sits. Does it sit with the managed care plan, or does it sit with the doctor's office? And depending on where that you put that risk, it affects how that program operates and ultimately its success. You also affect the flexibility of innovation and safety. So every piece of your legal work, whether it's drafting or advising or enforcing, and every contract, every regulation, you are an architect and a major part of that algebra. So you are important.
I love that. I absolutely love that concept. I had never really. I think it's very true. We do have to craft. When our clients come to us, we have to craft the arrangement often and the regulatory structure to make sure things are followed and done, which regulation is often to assure safety, but also it can be to promote innovation. So I love that. I love that term architect. I'm going to think of myself as an architect now. So another concept in your book that you talk about is the public startup. Very interesting concept, kind of a novel concept. And how would you say that intersects with moral algebra?
Yeah, so I think that's where the two ideas connect is in this book in public startup. So, government. So I came from academia. When I went to government, I was expecting to, wag my finger and say this is how it should be done. But what I found actually is that government isn't a typical static, slow, sclerotic, bureaucratic system, even though it might feel like that sometimes. But there's actually a lot of innovative and flexibility and a lot of iteration that goes on. I think the reality is that this algebra is full of uncertainty. And these government policymakers are tolerant of this uncertainty. We don't always know the right balance between access and cost. We don't know in every situation how to weigh innovation and safety. We don't know because the innovation hasn't been, it's only been tested in early phases. We haven't deployed it at scale to millions of people. And we don't know sometimes what is the best individual versus population implementation that we should roll out. We don't know in government. And so we have to make choices and have this flexibility to make our best guess, based on the data that we have. Public startup is what happens when a government acknowledges that uncertainty. And instead of saying, oh, we have the answer, it starts to test. And it sets up policy like federal waivers to test the ideas that we don't know for certain, but we're going to test these various ways of making healthcare available, and we'll see what works best rather than having a fixed decision. It treats policy less like a final judgment and more like a prototype, something that you would see in a startup company where they're throwing up a prototype to see what works. And if it doesn't work, they scrap it. Public startups, they don't eliminate the trade-offs. Instead, they kind of lean into them. And that's what I saw in government is these bureaucrats leaning into innovation.
That's very cool. Yeah, I mean, I've definitely seen it in terms of when there's a grant available. I see in the private sector people coming together because they see an opportunity because there's funding. And a lot of times people have ideas, but if they don't have funding, they can't get it off the ground. And I do think that Medicaid plays a key part in all of that. So when I was reading your book, I noticed there are three themes. And so one of those themes is about margins. And you argue that innovation starts at the margins. Why do you say that?
Yeah, so in Medicaid, so as you very well know, to be on Medicaid, you have, in Florida especially, you have to be under crushing poverty. So the innovation right away in Medicaid starts at that margin. It's where, and it's also when you're helping a population of people under crushing poverty, that's where the problems are most acute and complex. And so in Medicaid, you've got complexity, you've got urgency. It's affecting their medical, their social, their economic parts all at once, all mixed together. This system, it can't rely on standard solutions. We have to come up with things that are unique and can handle the complexity and urgency of this population. And so we're forced to try new approaches all the time and adapting things. And that's the pattern that I've seen over and over again, is that this innovation happens when the problems are the hardest. It's that necessity that requires us.
Yeah, I've definitely seen that in my career early on with HIV, and then more recently, of course, COVID. And I think a great example is through COVID, so much we made. Telehealth was always kind of there. And then with COVID and solving, and I think a lot of that came through public efforts to enable telehealth so that people could get the care they needed without, so I definitely see that. I think that definitely rings true what you're saying about the margins. When things get tough is when all of a sudden you see innovation kind of catapult forward, which is wonderful. Yeah. So speaking of bureaucrats, one of the things in your book is you talk about that they take risks, which is not at all the stereotypical view, right? Like typically we think of bureaucrats as risk averse.
Yeah.
So explain about kind of that concept and why you say that they take risks.
It does sound counterintuitive, and I would not have guessed it either until I had been inside the system. But they do take a lot of risks. And it's because these people are on the front lines. They're just not on the typical front lines that you would think of. Like sometimes they're in courtrooms. They're not in, clinic exam rooms, but they're in the front lines of being on the firing line in a legislative committee, or they have to report to the governor's office on their actions. And that's under the crucible. I mean, if you look closely on the recordings, they're usually drenched in sweat because of what they're dealing.
I'll look for that.
Do that, on the Florida channel. That's right. And so, they're deciding how to interpret the rules, the directives that the legislature is giving to them, how far that they can push flexibility, how to make programs really work for the people of Florida or the nation. And they're mission-directed. People that take that kind of job are taking a pay cut, and they're usually very mission-directed. They really believe in elevating society and working for their fellow neighbors. So in many ways, these risk takers in government, they're not elected officials. They're people that are implementing policy, and they're doing it kind of quietly for most days, but then they're surfaced to come out to committee, and that's when you see them under the bright lights.
Yeah, attention brought to these difficult decisions they had to make.
Yeah.
So another concept, safety nets.
Yep.
So usually people think of them as a hammock, and you think of it as a ladder.
Yeah.
So tell me more about what that means.
Yeah. So Rupa, what I'm trying to do is to shift how we think about the purpose of the safety net. I mean, yes, we do catch people after they fall, but that's the purpose is to get people back on their feet so that they can thrive and reintegrate into society and to go after that purpose that they have in life. That's really the purpose of the safety net. So it's more of a ladder. It's too often framed, simply as a post-failure support, and it does, but it does much more than that. So it creates mobility, it creates resilience. I've seen it create participation back into community again, because we want all people participating to the best extent that they can. And really, the best safety net doesn't catch people after they fall. It helps them climb.
Yeah, it's a step up, not a handout, right?
Exactly.
Yeah, absolutely.
Yep.
Yeah. So, of course, kind of the crux of your book is about Medicaid as innovation, right? And that's also not typical. People don't think of Medicaid as innovative. So why do you?
So why? Yeah. Especially, and it was shocking. I'll admit. I'm a physician scientist, so I've discovered ways that cancers hide from our chemotherapies. I've patented drugs. I've spun off companies, and so when I went to government, I thought, oh, there's going to be low innovation, and it turns out that there was quite a bit. So I think when you're operating at the scale that Medicaid is operating at, I mean, we've got millions of people that are, again, in poverty and with complex conditions, genetic conditions that they didn't ask for. I think because of that social need, that clinical complexity, you can't just take what works for everybody and make it work for that population. You have to create something new. And I think Rupa, the key element that makes Medicaid innovative are these federal waivers, these 1115 waivers, these 1915 waivers, where the government says, okay, if you have a new way of doing something, write it up, send it to us, and we can waive certain standard rules to allow you to experiment in serving, moms that are addicted to opioids, or in serving rural areas. They might have some special needs. And so these waivers are crucial. And I should say they often involve teams of attorneys that help us craft it to make sure that we've got it crafted.
And also then on my end, I do have many clients who have benefited from these waivers and been able to structure programs that they otherwise would not have been able to. And so it takes attorneys on both sides, first developing, what the carve-outs will be, and then on the client end to actually roll it out.
Yeah.
So, So, as a closing question, if somebody reads your book, what do you hope they take away from it?
Well, I would first thank them for taking a chance on this conversation and this taking interest in how ideas are formed and how they grow and scale. I would say that the takeaway would be that government isn't the obstacle to innovation, and it's actually one of our greatest untapped tools for solving complex problems in our society.
And so if someone wants to learn more about these ideas or get a copy of your book, what do they do?
Yeah, great. So the book is Public Startup, and it's available at your local bookstore, which I would absolutely advocate to go to them and ask them to order it. It's also available on major online booksellers like Barnes & Nobles and Amazon. And if you work in healthcare, policy, law, I think it's going to change how you see the system and how you think it works. I'm hopefully unroofed some aspects of our jobs that I think are unusual.
Well, you certainly did for me. It was very eye-opening for me to read your book, and so I appreciate your writing it very much, and the insights you bring from the various different roles you've had throughout your career. Again, Chris, thank you for thoughtful, engaging conversation. You've given us a new lens to see the work we do, not just as navigating roles, but as shaping systems and values within them. For those watching, I encourage you to explore public startup and continue thinking about how each of us in our roles participates in this wonderful term that Chris has coined of moral algebra. So, Chris, I have one more thing to ask before we wrap up. Will you sign my book for me?
It'd be my honor, yes.
I have a pen.
Okay, great. Thank you. Do I have to do it in triplicate like attorneys?
One will do.
Great. Thank you.
Thank you. And thank you all for joining us.